Our time of standing pat and putting off unpleasant decisions, that time has surely passed. There is work to be done. Raise healthcare's quality and lower its costs. All this we can do. All this we will do. There are some on the precipice of an achievement that's eluded Congresses and presidents for generations. I am absolutely confident this is going to pass. Feeling cautiously optimistic we can get this done. Now, for the first time, there is a clear majority in the Senate that's willing to stand up to the insurance lobby and embrace lasting health insurance reforms that have eluded us for generations. Let's bring this long and vigorous debate to an end. With passage of reform bills in both the House and the Senate, we are now incredibly close to making health insurance reform a reality in this country. Our challenge...
7 most important things the new health care bill will affect. The Patient Protection and Affordable Health Care Act, more commonly referred to as the Health Care Reform Bill, has been a lightning rod for political debate because it effectively reshapes major facets of the country's healthcare industry. Number 1, you must have medical insurance. Under the new law, you will have to purchase health insurance or risk being fined. If your employer does not offer health insurance or if you do not earn enough to purchase, you may get assistance from the government. Additional $33 million will be insured under this bill. Number 2, more healthcare jobs. Looking for a job? Well, this is your chance. With the new bill, there will be additional $33 million insured. There's going to be a huge demand for medical professionals across the nation. Number 3, kids can stay on your policy until they're 26 years old. Currently, many insurance companies do not allow children to remain on their parents' plan once they reach 19. Companies cannot do that anymore. Number 4, insurance cannot drop you. Your health insurance will no longer be allowed to cancel your policy if you get sick. 5, you cannot be denied insurance. Starting this year, your child or children cannot be denied coverage simply because they have pre-existing health conditions. Number 6, no maximum limit on coverage. Companies will be barred from instituting caps on coverage when your cost for treatments go up due to sickness. Number 7, no waiting time. If you currently have pre-existing conditions that have prevented you from being able to qualify for health insurance for at least 6 months, you will have coverage options.
Pro number 1, insurance for everyone. The public health care option is there to help each and every person in the country get insurance that they can afford and that will cover expenses. President Obama stated that this is simply an option. If you currently have insurance that you are satisfied with, you can keep it without penalty. If your employer currently offers insurance, they will not be penalized. Pro number 2, pre-existing conditions to be covered. Often medical coverage gets changed through an employer, or a company downsizes and an employee is left without insurance. The employee or individual has to go about finding coverage on their own. In most cases, if this person has already been diagnosed with the condition, the new insurance has grounds to refuse coverage to that person or offer them insurance that does not cover any treatment related to pre-existing conditions. Pro number 3, lower prescription costs. One of the highest costs in healthcare is medications. Even with insurance, the co-pays on medications can set patients back quite a bit, especially middle to lower income. Pro number 4, equal coverage for all. With everyone having insurance, the cost of healthcare for everyone will decrease. An insured person will no longer carry the burden of higher costs to cover the uninsured. Treatment options that are necessary will be available to everyone that needs them instead of to only those who can afford them or whose insurance will cover them. Pro number 5, no financial burden on our children. Pro number 5, no financial burden on our children. In President Obama's speech on September 9, 2009, he stated that while the cost of the healthcare reform was $900 billion, it would be covered by money that was already in the budget that was being misused. He stated that the bill would not add one dime to the current deficit. It would actually decrease it by 0.1% each year. Pro number 6, care for the elderly. Obama's health care reform policy ensures that Medicare is a treasure that must and will be protected for generations to come. He proposes to decrease wasteful spending in Medicare by tackling false claims and other Medicare abuses. Pro number 7, medical malpractice reform. President Obama's plan includes the reform of the Medical Malpractice Act. The reform will make fraudulent lawsuits stop, and they will help allow doctors to practice responsible medicine to make sure that patients are getting the care they need and not the care that protects the doctor.
Hi, this is Dick Morris. You know, we're entering the final climactic last few weeks or months of this battle to stop Barack Obama from destroying our healthcare system in the United States. It's a terribly important fight, and I wanted to talk to you about the stakes and about what we need you to do to help. First of all, his plan is becoming clear. He's going to take $500 billion and cut it from Medicare, just eviscerating the program as we know it. Now, he claims that that's not going to impact patient care, that all he's going to do is eliminate waste and inefficiency. But that's nonsense. What he's really going to do is to cut the reimbursement rate to doctors, reduce the amount of money that they can make for seeing patients, reduce the amount of money that can be charged for MRIs and CAT scans, and the result will be fewer doctor visits, fewer CAT scans, fewer MRIs, and shorter and more perfunctory medical care. Then what he's going to do is to require the uninsured to buy health insurance. He claims it'll be affordable, but when you look at the statistics, it's not very affordable. The Congressional Budget Office estimates that the uninsured will be required to pay 20% of their income, slightly less than 20% of their income, in premiums, deductibles, and co-payments to get that insurance.
Con number 1, the cost. Many worry about the actual cost of the reform. It has been stated that the reform will cost $900 billion, and the President states that will cover by money that is already in the budget that is being used wastefully. However, there have not been any clear-cut explanations of what wasteful spending is and where it will be coming from. Con number 2, possibility of healthcare providers increasing coverage rates. In an effort to still make the same income, healthcare providers may increase their fees. Without a policy that defines how healthcare providers can charge, the patient may still have to pay more in the end. Just as today, a cash-paying patient will pay a different amount than a patient with insurance, and each insurance company has negotiated rates with the providers already. Con number 3. Providers may refuse to accept public insurance. This issue has not been covered in any information that is currently available. Not all healthcare providers accept all insurance carriers. Will providers be able to refuse public insurance? There are just a few of the pros and cons of the current healthcare reform proposal as we know it. As more information is released, the positives and negatives will probably change. The bottom line remains that the United States needs healthcare reform.
Today, after almost a century of trying, today, after over a year of debate, today, after all the votes have been tallied, health insurance reform becomes law in the United States of America.